It is 5 o'clock sharp, so thank you for being here on time. We have 4 regrets this evening: Paul, Linda, Ian, and Neela. But we do have quorum and everyone's here, so thank you. I'll start with the land acknowledgement. We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkwin, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Odawa, Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. So again, thank you and welcome to the October open board meeting. And I will call the meeting to order at 5. And are there any declarations of conflict of interest? Okay, seeing none. In your package, thank you, Dawn, for circulating those. We have the previous minutes of September 5th, 2024. Assuming everyone's had an opportunity to review those, can I please have someone move those minutes? Thank you, Laura. And seconder? Cindy, thank you. Any amendments, deletions, modifications, questions? Okay, seeing none, all in favor? Perfect. The minutes of September 5th, 2024 carry. And now we have the report of the Acting President and CEO, Ms. Karen Riddell.
Thank you. All right, good evening, everybody. So my report was in the package. I'm just going to hit some highlights for you this evening. So under our culture of patient safety and quality of care, we continued our work on our new MRI. So the crane arrived on September 23rd and installed that, so that's exciting. And we should have that new MRI at the Olette campus operational the week of November the 11th. We also are into the construction for our expanded cath lab at the Olette site. So this is very exciting. We've been waiting for this for many, many years, and we'll look forward to finally having 2 cath lab tables to serve our community in the near future. Not only will this help us to shorten our wait list for procedures, but also will allow for expansion of the number and type of procedures that we're performing. We also had our 5th annual Sail into Summer event, and that raised over $52,000, and those proceeds are going to help us purchase a new state-of-the-art Da Vinci robotic surgical system for Windsor Regional. So the Da Vinci is a robotic surgical system that uses a minimally invasive surgical approach, and that reduces recovery time and increases the number of surgeries that are performed in our hospital for the community. So that's great news, and thanks to that fundraiser. I do want to highlight this month the work of our and availability of our employee wellness programs. So our Windsor Regional Hospital Wellness Program offers activities and programs for all employees, professional staff, and also their immediate household family members for all employees. This wellness program has been designed to have something for everyone and focuses on the 5 dimensions of wellness: physical, emotional, intellectual, spiritual, and social. And activities include exercise, cooking classes, community volunteer activities, golf lessons, boat cruises, community festivals, and much more. And many of our employees and professional staff participate with their families and friends each month. In addition, our Employee Assistance Program and our Wellness Portal app offers staff 24/7 confidential access to health and wellness resources, fitness and nutrition, financial wellness, home and living, and many other resources. And last but not least, with regards to the work that our human resources team is doing, we've had many active booths over the last number of months at job fairs across the province, looking to recruit some of our hardest to find disciplines. So great job to the health records, human resources team. This month, we also saw the launch of our new collaboration with the Windsor Police Department, Hiatus House, and Family Services Windsor Essex, providing immediate real-time support to victims of intimate partner violence. Through this new partnership, the Windsor Police will work with all 3 community partners to ensure victims are connected with a social worker on site immediately following an incident. And this intervention is pivotal in guiding victims towards safety and recovery. Over the next 3 months, the pilot will run 3 days per week from 3 to 11, increasing to 5 days a week by the end of this month. Victims will also have access to 24/7 virtual support services through Hiatus House, And the expanded service model is drawing on cross-sectoral collaborations such as the nurse police team, the crisis response team, both of which have been proven effective in similar contexts. So we're very excited to be offering that service to the community. You'll have seen likely in the news the Soltz Family Foundation making history with a historic gift of $15 million to purchase technology and equipment for the new hospital. That gift will be critical in funding equipment and technologies for the new Windsor-Essex Acute Care Hospital and will be the most significant healthcare transformation in Windsor-Essex history. In recognition of that gift, the Family Birthing Pediatric Care Center, as well as the Pediatric Emergency Zone located within the emergency department, will be named after the Soltz Family Foundation. We also had a visit that same day from Premier Doug Ford, who attended the ceremony, to thank the Soltz family for their contribution to the project. While there, the Premier reinforced his support for advancing the hospital project, adding he would like to go as quickly as possible, cut out all the bureaucracy, and get the shovels in the ground. So we're looking forward in the near future to getting more information on that. In addition, to support engagement with our Indigenous communities in this next stage and to ensure the design is culturally safe and a welcoming space for our Indigenous patients and visitors, the Project Management Office team is pleased to welcome Audrey Logan. Audrey is an experienced leader in Indigenous health and brings a wealth of experience to the new role. Prior to her recent work as Director of Health Equity and Indigenous Populations at Ontario Health, Audrey worked at Windsor Regional Hospital for 11 years in various roles supporting Indigenous patients and families. So we're very excited to have Audrey back on our team. And that is the highlights from my report. I'm happy to take any questions.
Any questions for Karen?
Great, got off easy.
Thank you, Karen. Then in item number 5 is the Schulich report, and Dr. Jacobs is not here this evening. However, the report can be found in tab C of your package for information purposes. And I will turn the presentation now and mic over to Anthony for our financial presentation and report on September 23rd, 2024.
Thank you, Madam Chair. I will do this fairly quickly. It was a pretty quiet month in comparison to the last few. Status quo, I would almost say. Obviously, as we look at this, the biggest numbers that we're looking at is the net deficit after building amortization. What we're looking at is $13.6 million through this point in the year. That's actually approximately $2.3 million worse than budget. And then from a hospital margin point of view, we were budgeting $10.3 million deficit, and we are currently sitting at a negative deficit of 2.7, or excuse me, our budget was $7.5 million. We are sitting at $10.3 million. I apologize. I'm clearly on my very clear sheet here. And then as we move down, so that's $2.7 million worse than budget. Main drivers, benefits. We have a net deficit of $848,000 through this point in the year. Moving down, we actually have a surplus in med staff fees of $450,000. That's a great offset. Moving down, we have med surge supplies. This one is always a difficult one to project through the year. We are currently sitting at a $1.5 million deficit to our budget. And again, unbelievable what we've done with the drug program here. Currently, we are sitting at a surplus of $992,000. And last but definitely not least is the ever important other supplies. These are a lot of ancillary costs throughout the organization. This could be one bad machine where it doesn't go through CapEx. There are many, many things that go into this number. It is not just one thing. So that is very, very difficult to budget. So that is currently sitting at a deficit of $825,000 to budget. Pretty simple report this month. Wish I had better news. Generally, we do kick it up a notch while we're looking for savings in the second half of the year. So big things to come. I see Melissa shaking her head that everything's going to be great and hunky-dory by the end of the year. See? But we are working diligently, and all the departments are looking to save their pennies. So we look for a little bit brighter future ahead. With that, I will move my report.
Thank you, Anthony. Will someone second? Jamie? Thank you. Any questions for Anthony? Seeing none, all in favor?
Thank you, Madam Chair.
Thank you, Anthony. That leads us to the consent agenda under tab E. And you will see the finance audit and resources of September 23rd, 2024 there. And that requires a motion, I believe, Anthony. So would you like to move that? Okay. Genevieve is seconding. Is there any questions or comments? Okay, seeing none. All in favor? Perfect. That motion carries. And then under tab F is your correspondence and printed material. For information is your media report. And I also just wanted to remind the board members that Dawn sent an email out on September 23rd, just reminding everyone to do the board self-assessment tool for fall 2024, and I believe it closes on October 25th. So if you have not yet completed that, I please encourage you to do so. So that leaves us to item number 9, board members' questions, comments, and notices of motions. I do not have anything else. I do not believe there's anything else. Does anybody have any other business? Okay, seeing none, that moves us to our next meeting of Thursday, November 7th, 2024, and that will be on Zoom. And I will ask for an adjournment at, I guess it's 14 minutes after 5. Thank you, Lori and David. All in favor? Perfect, the meeting is adjourned. Thank you, everyone. Thank you.